Well, I'm Randy Aldridge, and thank you for joining us for Political Pulse. Today I have our CEO, Chip Baggett, and Hannah Rice. Thank you both for talking with me today. We've got a lot to unpack. We are in session right now, and by all measures, the medical society is making waves. And I think that there's proof in the pudding there because we've been getting attacked by both insurance companies and the nurses. A lot of questions for both of you, but I want to start with you, Hannah. Just let everybody know, all of our members know, what are our priorities right this moment?
Yeah, so your advocacy team has had over 125 meetings with legislators, which is a great start to session. Our main focus has been on House Bill 649, the prior authorization reform bill. We've been talking to both House and Senate members about this bill. We've gotten great responses, great feedback. It seems like everybody is on board with this, so that's great. The bill is currently sitting in Senate rules, and we are hoping that our meetings are making some headway to move it out of committee before the end of session. And then most recently, we have had a scope of practice issue come up, and this was in the form of a PCS, so a proposed committee substitution in Senate Health that had a lot of scope of practice information surrounding NPs and CRNAs.
So that's a great transition here because I want to talk about that. First of all, congratulations on that many meetings. That is a lot of work. So congratulations on that. And Chip, you're over there all the time too. The healthcare committee met just last week to talk about this. And a lot of things happened. Can you unpack that for us a bit?
Yeah, so this is the second week in a row that they took the Interstate Medical Licensure Compact bill, which would be a jobs bill. It would recruit doctors to North Carolina, bring them in easier from other states, allow them to cross state lines to take care of patients. And they added in all this other stuff. They added in nurses being able to practice without physician interaction. They added in a tax on anesthesia. They added in fee cuts around facility fees. They added in more beneficial provisions for insurance companies over doctors and patients. And I think all this was really just a distraction to get us off of our game. Hannah pointed out that we've had really good interactions about prior authorization. We've had great interactions about increasing Medicaid rates that haven't been updated since 2012. And those are our priorities that they don't want to give. And so therefore they're going to attack us on all these other things.
So when you're meeting with these legislators, what are they telling you their reasons behind not being 100% with what we're asking for here? What's the reasoning behind all of this?
Yeah. Anna?
I don't think that they have a reason. We get the question a lot, why don't insurance companies do this voluntarily? And unfortunately, I don't think that they are going to. So we have had to present it in form of a mandate and force them to.
Because I think everybody here in the state, if you're an adult, you have a prior authorization story. I mean, we all do for what seems to a lot of people. I mean, obviously there are big medical issues, but even for simple things. And I don't think everybody gets it, that they understand why insurance companies, their first word seems to be no. Yeah. It's where they start. Chip, can you enlighten us on how and why this is happening?
I think the Senate leaders that are pushing it would say that the insurance companies, this is a tool for them, and that they need to keep all the tools in the toolbox to lower healthcare costs because of data that says we're expensive in North Carolina. What they don't pay attention to is the personal impact that you're talking about, right? So patients are seeing delay in care. Patients are seeing denial of care coverage, right? So that's a serious issue. Doctors are also, PAs are also spending hours and hours a day on this. So when they say that they're doing all these other things for access to care, well, they could eliminate prior authorization or reduce it significantly, and we could turn those couple hours a day that we're spending on prior authorization into patient visits. That would increase access to care with the current population that we have right now in North Carolina.
It all seems like a safety risk for patients, for all North Carolinians, because we're never further away than a moment from needing health care. Yeah. Nobody seems to be thinking about the safety risk in all of this. And this is just as a person on the street, I'm asking these questions. It just doesn't seem to make sense. These seems like easy questions, and I don't understand what the roadblocks are. I don't know if either one of you can enlighten me on that at all.
I think most of these issues have been things that we've been talking about for a long time, right? Nurses have wanted to practice without physicians for a very long time. They say they're going to make referrals, but in every state where that happens, referrals go way up and access to referrals go way down, right? So functioning in a team, which we've been promoting along with our PA partners, for years now is the best way forward for patients. I think they talk about saving money. And we know that anytime nurses or others are out practicing on their own, costs go up. But yet, this is the solution. And like I said, if we can get people care within the team, if we can get care in a more timely way, that saves money, right? And when it all comes down to it, these insurance companies, they're asking for this tool in the toolbox, but all they're really trying to do is control, right? Because control means that they have control of the money. They get to say no. And when they get to say no, they get to keep the money that they've taken in for premiums. They don't have to pay it out. And that's what it really is, because if you look at their data, it doesn't prove that it's really reducing costs. Premiums aren't going down. Your benefits aren't going up. Mm-hmm. This is not making things more efficient. This is just adding costs to the system, perpetuating a bad system that's hurting our members.
And it is something we are working on here quite a bit. Next week, actually, I'm going to be talking with John Thompson about insurance companies and the financial side of that. To wrap this up, our members are always asking, how can we get involved? How can we help? What should we do? And you're the woman who knows that.
I am.
You're the one to go to.
I am. So the best way to get involved right now is to attend our White Coat Day on June 12th. You have to register beforehand, so we'll link it to this video. But it is a great way to talk to your legislators, talk about your profession, talk about your patients, tell your personal story. That's who they want to hear from. They want to hear from our members. And so that is a great platform for them to do this.
I think that's so important, because the stories being told about our members right now are not flattering and they're not accurate. So we need them to show up and correct the stories at the General Assembly.
And we are making it very easy for you to show up. It is everywhere we can find morning rounds. You don't even have to open it. You can click at the top. Starting tomorrow, you can click at the top and register today. Yes. We also have it on our website right at the top. It's anything that you want. Our social media is kind of flooded with it. So you have no excuses to please show up June 12th. I mean, we'll serve you breakfast.
We will. And dinner.
And dinner. We'll do it all. All right, thank you both for talking with me. Again, we're going to be talking about these insurance companies and the financial side of this next week. So make sure you tune in for that as well. And you can find more on our website, ncmeds.org.